it's late and you're exhausted probably, a whole day listening and trying to understand different projects, different concerns. But I think today I have been not a whole day here. Honestly, I had to go back to the Congress in Gran Via because I had some appointments there, some media, etc. But from the program, from what I was this morning, this afternoon, what we did today here is to share talent. And that's very important. Because the only way to make progress in an area complex as it is, this one, needs talent. And this talent is there, here. And we have seen so many good things happening in the world, and the concern and the motivation. And one thing I want to highlight is, as this morning I said at the beginning of the session, is we are trying to connect beings, people. And that's the main idea. And the hype sometimes from the media, sometimes from society, fantastic. It's not fantastic, it's very difficult. It's very difficult. We know that. We know we are against the tide. The tide is easy, comfort, not changing. I remember The Economist, I think 2 years ago, 1 year ago, was a special report on why in the Western world healthcare systems don't change. And I was amazed because it said something very real. When a government, a new government, regional or national, comes up, the Prime Minister tells to the health minister, do nothing. Keep going. Don't spoil it. Don't fix it. It's going well. Don't change it. Because what we know, and that is, I think, all countries, in the Western world at least, health is not something giving support to governments, votes to governments. If you're making mistakes, you can lose the elections, but not, you can have the best healthcare system in the world as a government, and you can lose the elections. You have mistakes and something is wrong, a hospital infection, an ambulance in a street not working properly, somebody, that is making damage. That means the healthcare systems are very, very rigid. They don't want to change because it's going on well. Now, at this moment, we're here in the hospitals, primary care, things are going on well. In the operation rooms, in emergencies, that's working. And why we're here telling them, you have to change? That's the problem. That's difficult. How we can ask them to change? Because at the end of the day, we don't want to have more mobile technology. We don't want to have more tablets or more connectivity. We want to help healthcare to transform, to be more close to citizens, to be more close to professionals, to make things easier for everybody, more safety. That's what we want. The tool is mobile technology or digital technology. Doesn't matter the name. That's the challenge we have here. And then you're very courageous because we're trying to make changes in our healthcare systems. Health and social care, because I think we have to mix both together, okay? That means that is the important thing. We have talent, we have will, a good will, but we need a great coalition. And Health and Wellness, this event organized, the final aim is to get this coalition, people together. And of course, sometimes we compete, sometimes because normal life is competition too, sometimes things are not going the way we want, sometimes somebody else keeps our ideas, sometimes it's normal, it's the real life. But we need to have this coalition. And the European Connected Alliance, Immobile Capital, the mHealth Competence Center, we have this end in our mind, how we can build up communities, ecosystems, in order to help each other in the objective to reach finally better life, the quality of life of the citizens and the patients and the professionals. Thank you for being here today. Thank you for listening, for speaking, for sharing experiences. I hope you enjoy now the network we have in a moment, the reception here. Enjoy Barcelona, sunny day. I don't know tomorrow, today is sunny. Take advantage. No. Sometimes it rains in Barcelona. Okay? Sometimes people say, Barcelona is raining. It's raining sometimes. It's not always sunny days, but today is a sunny day. Take advantage of that. Enjoy Barcelona. Enjoy the coalition we are. And have a nice day today. And see you tomorrow in the Congress. And we continue this conference. Thank you very much.
So my first duty, excuse my voice, is to give you instructions, which is fun. And that is that tomorrow, as Joanna said, it is in a different venue. I know many of you are going there. The tip is leave early from the city. Go to the north entrance, to get that right? The north entrance, because it's quicker and easier to get to where we are meeting. I was there yesterday, and it took someone 1 hour from entering the conference room or hall to get to 3 halls down. So just to tell you, if you want to be fit, go to Mobile World Congress and just walk. So to summarize today, I think talking to many of you over the last, well, it seems like a couple of days, but today, I think from what I can see, people enjoyed the agenda. I'm really grateful to the speakers. I'm really grateful to the startups and others, because to stand up in front of all of you and speak, especially if you're a startup, and make that pitch is not easy. But it's great that we had that involvement of people. We in the European Connected Health Alliance, along with our partners, Joan and his team, are really determined not to do what everybody else does. Just by our nature, we are disruptive. Someone said to me, you cannot be innovative if you're old. Now, I don't consider myself old, but I still think you can be innovative even at my age. My grandsons asked me, what age are you going to retire, Grandad? On FaceTime the other night. And I said, 95. And they looked at each other and had a bit of a chuckle, and they said, we checked the life expectancy of men. And Grandad, you've no chance of getting to 95. These are 13, 11-year-olds. And the reason I tell you that story is that younger people actually expect to know everything they want to know, and they expect to know it instantly. They have no difficulty absorbing huge amounts of information and data, and they've no trouble at all in giving their grandfather a hard time either. But from your perspective, I think that I really do encourage you to keep this networking going, the conversations going, the follow-up going, because even today I've seen a number of handshakes, initial conversation, followed by a longer conversation, which I'm sure and I know a number of potential deals are already being discussed by some of you with others in this room. So please don't stop doing things. I want to thank all of our sponsors. I want to thank every one of them, because, you know, it's not easy these days to get people to spend money. We, on the other hand, have a financial burden to put these things on. And without our sponsors, we genuinely could not do this. I want also to say that the team that you have met today, including Bea and Julian and Damien, and everybody in Mobile World Capital, Barbara and Patricia, and of course Joan, have worked really, really hard for many, many weeks, maybe months, to make this work. So I'm really grateful, and I would ask you to join me in thanking all of them, please, for all their support and so on. So finally, to say this, we look forward to seeing you tomorrow. You don't have to leave now to get the Grand Via, but you should leave early in the morning. I'm certainly doing so. And to say that we have a networking reception to follow up. And we really look forward to seeing you tomorrow. I think we have an amazing program tomorrow. But you know, the last people to thank are you. If you didn't register, if you didn't come here, if you didn't participate, this wouldn't mean anything. So it's really important just to keep going. So don't stop. You don't have to work till you're 95, but you have to keep working. Thank you very much indeed.